Hello, my name is Marcela Morales Martinez, and this is my final project for the Nursing English 2. And I will talk about examining patient or physical examination.
Physical examination is a process of evaluating objective anatomic findings through the use of observation, palpation, percussion, and auscultation. The information obtained must be thoroughly integrated with the patient's history and pathophysiology. Materials: cotton whisk, flashlight, phlebotometer, stethoscope, thermometer.
The best resource available to the physician to set the stage for the physical examination is communicate, respect, and genuine interest the patient's welfare. And the patient should be addressed politely and asked to perform the required maneuvers of the examination and technique for preferable to imperative language such as I want you to. Patients should be prepared for unpleasant portions for the examinations. And the components of the physical examination are inspection, percussion, palpation, auscultation. The first is inspection. The examiner will look at or inspect specific areas of your body for normal color, shape, and consistency of skin, and certain findings on an inspection may alert your healthcare provider to focus other parts of the physical exam on certain areas of your body. For example, your legs may be swollen, and your healthcare provider will then pay special attention to the common things that cause leg swelling, such as extra fluid caused by your hair, and use this information to help them make a diagnosis. And common areas that are inspected may include your skin, look for bruising, cuts, moles, or lumps in your face and eyes to see if they are even, normal, reactive, in your neck veins to see those are bulging, distended, or swollen, and the chest and abdomen, stomach area to see if there are any masses or bulges, your legs to see if there are any swelling, your muscle to check for a good muscle tone, your elbows or joints, check for the swelling or inflammation, any deformities are present. The second is palpation. This is when the examiner uses the hands to feel for abnormalities during a health assessment, and things that are commonly palpated during an exam include your lymph nodes, chest wall, and to see if your heart is beating harder than normal, and your abdomen He or she will use palpation to see if there are any messes or lumps anywhere in your body. And the third is percussion. This is when the examiner use their hands and to tap on an area of your body, and the tapping produce different sounds depending on the kind of sounds that are produced over your abdomen and on your back or your chest wall. Your healthcare provider may determine anything from fluid in your lungs or a mass in your stomach. This will provide further chest close to use a possible diagnosis. The fourth is auscultation. This is an important physical examination technique used by your healthcare provider, where he or she will listen to your hair, lungs, neck, or abdomen to identify any problems or abnormality you're present. And auscultation is often performed by using a stethoscope, and the stethoscope will amplify sounds heard in the area that is being listened to. If there is an abnormal finding on your examinations, further testing may be suggested. The neck. When your doctor or healthcare provider is listening to your neck, and there are often listen for a swishing sound in your arteries. This may suggest that there is a narrowing of the arteries, which will increase the sound of blood flow. And the heart normally produce a long dub sound when the heart valves are opening and closing during the flow of blood. Your healthcare provider will listen to see if your heart is beating regularly, and or if there are any murmurs, extra tones with every heartbeat. And her murmurs may be innocent, meaning they are normal, but non-life, they're treating, or they may signify a problem may be present. And to diagnose this, your healthcare provider may listen with their stethoscope to many areas around the hair, and instead of just one area, and suggest further testing if necessary. The lungs, your doctor or healthcare provider may listen to your lungs with their stethoscope, and anywhere on your back, posterior, or on the front of your chest wall, anterior. He or she may be able to tell if air is moving to the bottom of lungs with each breath. These are called normal long zones, and if there is a blockage, a constriction, or narrowing of your lung tubes or fluid in your lungs, and this can be heard by the examiner. The abdomen will be examined using a stethoscope to listen for any swelling, sounds of blood, and so the arteries near your stomach, such as the aorta or abnormal bowel sounds, and other locations. Auscultation may be used anywhere your healthcare providers want to listen. The neurologic examination is other component of physical examination. During a physical examination by the healthcare professional, a neurologic examination may be performed, and this can be very brief or more detailed depending on concern and findings. In general, the physical examination is divided into 4 parts: cranial nerve assessment, motor functional assessment, sensory functional assessment, or an assessment of reflex. The cranial nerve assessment, there are 12 cranial nerves that arise from the brain. Each nerve and has its own function, and the assessment of the nerve is done by evaluating each function. For example, testing the gag reflex with the tongue depressor is testing the 9th and 10th cranial nerves. The motor function assessment is checking a person's gait, muscle strength, and coordination, and the test where a person is asked to touch their nose and then finger of the examiner with eyes open, then which eyes closed, is an example of how coordination may be evaluated. Sensory function assessment is checking sensations such as pain, temperature, position sense, and crude and fine touch along certain pathways, and a test that may use to evaluate this is asking the person to close their eyes and then using a wisp or cotton as the person if they can feel the cotton brush and on the skin. During a physical examination, testing reflex helps to assess the status of the central nerves system, and this is an indicate whether the pathway from the spinal cord to the area stimulate and back is intact, and the briefness of response is evaluated.